Halton Police have been tackling the opioid crisis while trying to prevent it through mental health crisis outreach.
We have our mobile crisis rapid response team, so that's an officer who has some mental health training, and they're paired up with a healthcare professional from St. Joe's Hospital in Hamilton, and they respond to our crisis emergency calls, typically mental health related. And we also have our COAST unit, which is our crisis outreach and support team, who they are paired with a professional from the Canadian Mental Health Association.
Sergeant Rick Judson says the service receives roughly 3,400 mental health calls a year, and the open lines of communication with partners across the region help to proactively de-escalate situations and offer help before those in crisis take the path of drug use and overdoses.
With those 3,400 calls that we respond to as a service, our mental health teams respond to about 60% of those. Our mobile crisis teams, they're the front line, they get up there, they deal with the situation at the time, but then they have a close connection with our COAST team as well, where they'll work with a social worker or whoever it may be to give those people resources in advance of another crisis. So it's communication, it's information sharing in order for it's the upstream approach with COAST to try and get them the supports prior to a crisis happening.
Just as mental health doesn't discriminate, neither does opioid use. And police are informing the public to be aware of the different ways someone can overdose on opioids.
The first kind is the traditional kind where someone has intentionally taken a drug, an illicit drug, in this case potentially opioids, and they have taken more than they can safely consume. And as a result of the dangerous nature of the drug, it has triggered a medical crisis, physiological symptoms in them that is very significant, which is life-threatening. The second type of overdose would be one where someone may have mental health issues and intentionally take more of a narcotic with the intent of taking their own life, which is obviously tragic in its own sense. And then the third type, the type that we're starting to see a little bit now in our community, is situations where a person may take an illicit drug, one that they may think is safe or safer, and unfortunately unknown to them that the drug has been contaminated with more dangerous drugs such as fentanyl, and as a result they're really ingesting a very, very dangerous combination of two different narcotics, and in those cases we're really warning the public to be cautious, because there's no such thing as safe street drugs here in any community.
At the end of the day, police just want to help and encourage drug users, legal and illicit, to allow them to assist thanks to the Good Samaritan Act.
We really want to let people know that we're there to help. The Good Samaritan Act of Ontario protects people who call 911 from some prosecution of some simple offenses such as possession of narcotics. The officers that would be arriving at an opioid overdose, or any drug for that matter, are there to help. That's their first and foremost responsibility, to help the person to get them the medical aid that they need, not to investigate persons there for other offenses.
For Halton News, I'm Natalie Stoberman.